Hi everyone, I'm Dr. Rashmi Kudesia, Director of Patient Education and Site Director of our Sugar Land office here at CCRM Fertility Houston. Today, it is my honor to contribute to our CCRM TV channel to talk about stress and fertility during the time of the COVID-19 pandemic. As a reproductive endocrinologist and fertility specialist, I know all too well that struggling with infertility and going through fertility treatment are very stressful as it is. Thinking about all of this during the time of an international pandemic only makes things worse. At CCRM, we are here to validate your concerns and help you think about how we can still move through your evaluation and plan making so that when the time comes, we can expedite your family building journey as quickly as possible. To me, the topic of stress and fertility is a very personal one. I actually wrote my fellowship thesis on this topic, and so I can say I've pretty much read every scientific paper on the topic. Here are my takeaways. First of all, it's important to differentiate between what stress means to most of us and what it means in the scientific literature. Oftentimes, when we talk about stress scientifically, we're talking about the kind of acute stress that we inherited biological mechanisms to deal with from the prehistoric times, when we might have run into a lion or a tiger and our body needed to prioritize certain systems, like our ability to run away or be safe, and deprioritize others, like our reproductive system, which wasn't as important in the context of a life-threatening acute stress. However, in today's day and age, that's not usually what we're dealing with. We're dealing with chronic stressors, which means our work frustrations, our dealing with commuting and sitting in traffic or being stuck on a busy subway. It could be difficult interpersonal interactions that we're having on an ongoing basis. Our body isn't as equipped to deal with these on an ongoing basis, and cumulatively, they do exact a toll on our health. There's no doubt about that. It's also true that some people have a personality that they're built with. Every body is built differently, where they're more predisposed to have impacts from these acute stressors. I have patients that come in and they say, hey, Dr. Kudesia, I've noticed that if I have a really stressful work deadline coming up or something, very stressful has just happened to me, my cycle changes. I notice that my period either skips or it comes too soon or the bleeding is different. Again, some women are just built so that they have more sensitivity to stressors in their daily life. This is important to realize, and I say it's a good time to sit with your body and keep track of changes to your cycle during the uncertainty that we're going through right now. It's important to track where you are and any changes to your health. The good news, however, is that we have the ability to control our coping mechanisms, and our ability to turn to healthy coping structures can make a big difference in dealing with not only the stresses, but also whatever our personality may be. The data shows that some women will turn to unhealthy coping mechanisms like substance use. You may have seen, as I have, all the memes around all the wine that we might be consuming during quarantine in the time of COVID-19. For my patients, this is not the best option. I don't want people using binge drinking or heavy alcohol use as a way to allay their anxiety. Substance use is definitely not what we're looking for at this time. I would say I want to keep the general recommendations I give of maybe a glass of wine here or there, but avoiding anything more than that, and definitely avoiding any other substances like cigarettes, marijuana, etc. Instead, we might turn to more healthy coping mechanisms like faith, our social networks, and believe it or not, with teleconferencing and other options, despite social distancing and being responsible, we can still keep track of our social networks and those that are here to support us. We're certainly here at CCRM to be able to help you think about how you can utilize this window to optimize your evaluation process, your plan making, and anything else in your life that will help you be as healthy as possible. For many of my patients, they've struggled for a long time with taking a pause to perhaps optimize their diet or exercise, and this may be a great window to do so. And honestly, this could make a big difference in someone's ability to not only get pregnant, but to have a healthy pregnancy and a healthy baby. What does that mean? It means that now you might have the opportunity to actually meal plan. It might mean that you're actually looking at healthy recipes, healthy snacks. You can see my strawberries in the background, and then being smart about, grocery shopping during low volume times, or doing online ordering or curbside pickup to get those groceries, being able to cook at home more as opposed to relying on packaged food that you might have to eat at work, and really optimizing your diet, being as close to that Mediterranean diet that we generally talk about as being pro-fertility. Exercise. Many of our gyms and fitness studios are offering free streaming that you can do at home, and so that's a great option. If you have the ability to walk around while still maintaining social distancing outside, also great stress relief to be outside, get some natural vitamin D, and reduce your anxiety that way. And I think the most important thing is to make room for uncertainty. We are all struggling with the fact that we don't know the exact timeline of how this will all unfold, but we are here to help you deal with your stress, to help you think of healthy coping mechanisms, and make a plan so that when we're able to start treatment, hopefully soon, you don't feel the impact of this delay in treatment. You're ready to move forward, and with our high industry-leading pregnancy rates and IVF success rates, we can get you there sooner rather than later. Please reach out if you have any questions about dealing with stress, the impact on your fertility. We're here to answer them. We're here to help you. Take care of yourself and stay healthy during these times.